Imagine this. Your horse suddenly starts acting really strange, maybe pressing his head against the wall or just wandering aimlessly, or even getting aggressive, which is totally out of character. What on earth could be going on? Today, we're diving deep into a pretty serious and often mystifying condition in horses called equine hepatic encephalopathy, or HE for short. And this isn't just about a horse feeling a little unwell. No, it's a profound neurological syndrome. And the kicker is, it actually stems from major problems with the liver. So our mission today is to unpack the fantastic sources you've sent us. We've got everything from like the basic science and pathophysiology to really practical stuff on diagnosis and treatment. We're going to pull out the most important bits of knowledge, the key insights, so you can really get a handle on this complex challenge, what causes it, sometimes surprising signs, and how vets actually manage it. Okay, so let's start unpacking this. We're talking about a condition where the brain is clearly affected, but the root problem is actually the liver. How does that connection even work?
It's fascinating, really, because hepatic encephalopathy, or HE, it's not a primary brain disease at all.
Right.
It's a consequence, a direct result, of the liver failing at one of its most critical jobs, getting rid of harmful stuff in the body, detoxification.
Okay.
When the liver gets severely damaged, we're talking like over 60 to 80% loss of function, and just can't filter out these toxins effectively anymore.
So these toxins, they just build up then in the bloodstream.
Exactly. Toxins like ammonia, that's a big one.
Yeah.
But also things like mercaptans, phenols, fatty acids. These are all byproducts of normal metabolism. Normally, the liver deals with them. But when it's not working right, they bypass it. Either the blood flow gets shunted around the liver or the liver cells themselves just aren't functioning.
And they end up circulating.
Right. They get into the general circulation. And then, crucially, they can cross the blood-brain barrier.
And that's where the real trouble starts for the brain, I imagine. It's not equipped for that, is it?
Not at all. Ammonia especially is highly toxic to the central nervous system. It messes with these really important support cells in the brain called astrocytes.
Astrocytes, okay.
Yeah, think of them as the brain's support crew. Ammonia causes them to swell up, which leads to increased pressure inside the skull. Not good.
Definitely not.
And it also completely throws off the balance of neurotransmitters, the brain's chemical messengers. It tends to increase the calming ones, like GABA, and decrease the excitatory ones, like glutamate. So brain activity gets really altered.
Wow.
Plus, you can get oxidative stress, problems with mitochondria, basically disrupting the brain cell's energy supply.
So with all that going on in the brain, how quickly does this happen? Is it sudden or more of a long-term thing?
That's a good question. It can actually show up as acute, subacute, or chronic. It really depends on the underlying liver damage, how bad it is, and how long it's been going on.
Okay.
And interestingly, there doesn't seem to be any specific breed or sex that's more prone to HE in horses, which, makes spotting the signs even more crucial.
Right. Which brings us neatly to the next part. This is where it gets really interesting, I think, because the signs of HE can be so varied. And they progress through stages. It sounds like it could be tricky to spot early on.
Absolutely. The clinical signs can range from, incredibly subtle behavioral things to really severe neurological problems.
Like what, in the early stages?
In the early stages, let's call it stage I or II, owners might just notice the horse seems a bit dull, depressed, lethargic, maybe not eating as much.
Okay.
Sometimes you see subtle personality shifts. Maybe a horse becomes unusually grumpy, or, this is surprising, sometimes they become overly friendly, almost unnaturally docile.
I also saw things like head pressing mentioned quite a bit in the sources. Is that common?
Yes, head pressing is definitely one of the classic signs. That's where the horse just stands and leans its head against a wall or a fence post, something solid. It's quite distinctive. Other early things. Mild incoordination, maybe some unsteadiness, we call that ataxia. Aimless wandering, just sort of walking without purpose or circling. Even persistent yawning can be a sign.
Yawning? Really?
Yes, frequent unexplained yawning. And some horses develop pica eating things that aren't food, like dirt or wood.
Okay, so those are the earlier, maybe subtler signs?
Yeah.
But then it can get much more serious, much more obvious.
Oh, absolutely. As HEK progresses, moving into stage 3 or 5, the neurological signs become much more pronounced. You'll see marked ataxia, severe incoordination, stumbling, maybe knuckling over at the fetlock.
Right.
Horses can also develop what looks like central blindness. It's odd because their pupils react to light normally, but they genuinely can't see. They bump into things.
Wow, that must be disorienting.
Very. And stupor, like extreme sleepiness, is common too. Sometimes they're really hard to wake up.
And I think you touched on this earlier, but I've heard about aggression being a potential and very dangerous symptom.
That's a really critical point for anyone handling these horses. Yes, some can become aggressive or even violent, and this might be interspersed with periods of that stupor we mentioned. It makes them unpredictable and potentially dangerous.
That's a serious safety concern.
Definitely. And while it's less common, seizures can happen in the later stages. Eventually, the horse might become recumbent, unable to stand, and that can progress to a coma.
Goodness.
We sometimes also see laryngeal paralysis that causes a kind of honking sound when they breathe and difficulty swallowing too.
And often these neurological signs don't appear in isolation, right? They're usually other clues pointing towards the liver problem itself.
Yes, that's
So,
very common. You'll often see other signs of the underlying liver disease alongside the HE. Jaundice or icterus is a big one.
that yellowing.
Exactly. Yellowing of the gums, the whites of the eyes. It's usually quite noticeable. In chronic cases, weight loss is almost always present.
Okay.
Photosensitization can happen too. That looks like a bad sunburn, especially on any pink skin, because certain pigments build up that react to sunlight. Right.
And other general signs might pop up things like colic, maybe diarrhea or constipation, even bleeding problems because the liver makes clotting factors.
So, okay, a horse is showing some of these worrying signs. How do vets actually piece it all together and figure out, yes, this is HE, and just as importantly, what's causing the liver failure?
Yeah, the diagnosis is really about putting together several pieces of the puzzle. It's the clinical signs we just talked about, plus lab results showing the liver isn't working properly. And really critically, ruling out other neurological diseases that could look similar. That's a huge part of it.
Okay, so what are some of those underlying liver problems that can actually trigger HE?
Oh, there's quite a range. You can have toxic damage hepatopathy from things like pyrrolizidine alkaloids. Those are nasty compounds in some plants like ragwort, or mycotoxins from moldy feed, even too much iron sometimes. There's acute necrotizing hepatitis Thieler disease is the famous one there. Often happens, 4 to 10 weeks after getting some kind of antitoxin.
Right, I've heard of that connection. Then you've got things like cholelithiasis gallstones, basically, or chronic active hepatitis, which tends to affect adult horses, maybe over 9 years old.
Yeah.
Even Tyser disease, a bacterial infection usually in foals, but it can happen.
And what about smaller equines?
Good point. In ponies and miniatures, hyperlipemia, too much fat in the blood, is a big risk factor for liver failure and HE. And sometimes, though less commonly, it can be liver cancer, or even something congenital like a portosystemic shunt, especially in breeds like Morgan's, where blood bypasses the liver.
Okay, quite a list. So once you suspect liver disease, what blood tests really nail down the diagnosis or at least point strongly towards it?
Blood work is absolutely essential. Now, you'll often see elevated liver enzymes, things like AST, SDH, GGT, ALP. These tell you there's liver cell damage.
Oh, wait, damage markers.
Right. But the really crucial tests are the liver function tests. These tell you how well the liver is actually doing its job. Markedly elevated serum bile acids are a very sensitive indicator that function is down.
Bile acids, got it.
Also, high total bilirubin, especially the conjugated part, shows the liver isn't excreting bile properly. And of course, the hallmark of HE itself is elevated blood ammonia levels.
Right, the ammonia. I heard collecting that sample can be a bit tricky. Needs special handling.
Yes, that's absolutely critical. Ammonia is volatile. The blood needs to be collected in a specific tube, an EDTA tube, kept chilled on ice immediately, and the plasma spun down and tested right away, or frozen.
Why is that so important?
Because if you don't handle it right, the ammonia level can actually increase in the tube after collection. We call that in vitro increase. That could give you a falsely high reading.
Ah, okay, good to know.
Other blood work clues might be low protein, specifically albumin, maybe low blood sugar or prolonged clotting times, all pointing back to the liver not doing its various jobs.
So blood tests are key. What else? Any imaging or other diagnostics?
Definitely. Abdominal ultrasound is really valuable. It lets us actually look at the liver.
Structure.
Exactly. See its size, its texture, look for specific problems like abscesses or signs of cholangiohepatitis, that's inflammation of the bile ducts and liver. In chronic cases, the liver might look small and scarred, fibrotic. Ultrasound can also help rule out things like shunts, although they're pretty rare in adult horses.
And the definitive diagnosis for the liver problem itself.
That really comes down to a liver biopsy. It's considered the gold standard.
Taking a small sample.
Yes, it gives us crucial information about the type and severity of the liver damage, the pathology. And that's vital for figuring out the specific treatment and, honestly, the prognosis.
This brings up a really important point, though. You mentioned ruling things out. Since a lot of neurological signs can look similar across different diseases, how do vets make sure it is HE and not something else entirely?
That's precisely why the differential diagnosis process is so important. It's absolutely key. We have to consider a whole list of other possibilities.
Like what?
Well, viral encephalitis, for example. Things like Eastern or Western equine encephalomyelitis, EE, or West Nile virus, even rabies. These can all cause severe neurological signs.
Okay, infectious causes.
Right. Then there's physical trauma, head injury, spinal injury, maybe a brain abscess or meningitis. We also have to think about equine protozoal, myeloencephalitis, EPM,
Oh, yes, EPM.
and EHM, the neurological form of equine herpes virus. Even toxicities like moldy corn poisoning or developmental issues like wobbler syndrome. It's a systematic process of elimination based on history, signs, location, and specific tests for those conditions.
Wow, it sounds incredibly complex to navigate. Given how serious this is, what does treatment actually look like for a horse with HE? What's the overall strategy?
Well, first off, the prognosis is often quite guarded, even poor, especially if the liver disease is really severe, long-standing, or if there's a lot of irreversible scarring, fibrosis.
The recovery isn't guaranteed.
No, definitely not. However, and this is important, if the underlying liver problem can be successfully treated, and if the liver still has some ability to regenerate, then yes, the HE can potentially be reversed.
Okay, so there's hope in some cases.
There is. Treatment is really multifaceted. It focuses on three main goals. First, reduce the production and absorption of those neurotoxins, especially ammonia. Second, provide really intensive supportive care. And third, crucially, treat the primary liver disease, whatever it is.
Okay, let's break that down. Reducing toxins first. How do you tackle that, especially the ammonia coming from the gut?
Diet is absolutely fundamental here. We need to switch to a low-protein diet. Less protein means less ammonia produced by the bacteria in the gut.
Makes sense.
And you pair that with easily digestible carbohydrates, things like good quality grass hay, maybe some oats, corn, or beet pulp. This provides energy and stops the horse from breaking down its own muscle for energy because muscle breakdown also produces ammonia.
So avoid high-protein feeds.
Generally, yes. Avoid things like alfalfa hay or other legumes because they're higher in protein. And feeding small meals frequently is better than large meals, as it helps prevent long periods of fasting, which can actually worsen things.
Okay, diet is key. What about medications to directly deal with the toxins in the gut?
Lactulose is a really important drug here. You usually give it orally or through a stomach tube.
How does that work?
It's a type of sugar that the horse doesn't absorb. It reaches the colon and makes the environment more acidic. This traps ammonia in the form of ammonium ions, which aren't easily absorbed into the bloodstream, so it keeps the ammonia in the gut.
Ah, okay.
Clever. And it also acts as a laxative, speeding things up, giving less time for bacteria to produce ammonia in the first place. We also sometimes use oral antibiotics like neomycin or metronidazole.
To target the bacteria.
Exactly, to reduce the specific gut bacteria that produce urease, the enzyme that generates ammonia. And in really severe acute cases, sometimes a warm water enema with some diluted lactulose can help flush out the colon quickly.
Right, so that's tackling the toxins. What about the intensive supportive care? What does that involve for a horse that's often quite sick and neurologically impaired?
Fluid therapy is essential. Usually intravenous fluids, often with added dextrose, which is a sugar.
Why dextrose?
Two reasons mainly. It helps correct dehydration and keeps the horse hydrated, but it also provides a direct source of glucose. This prevents low blood sugar, hypoglycemia, and also helps reduce that muscle breakdown we talked about. Correcting any electrolyte imbalances found on blood work is also vital.
What about managing the neurological signs, like if the horse is agitated or stumbling, sedation?
Sedation needs extreme caution. You have to avoid drugs that are heavily metabolized by the already struggling liver or drugs that are strong CNS depressants.
Okay, so what can you use?
Generally, the alpha-2 agonists like ditomidine or xylazine are preferred. They have less impact on the liver and breathing, but you use them at the absolute lowest dose that works.
So anything to definitely avoid?
Yes. Specifically, avoid benzodiazepines drugs like diazepam or Valium. They act on those GABA receptors in the brain, and since HE already messes with GABA, these drugs can actually make the neurological signs much worse.
Good to know. What else falls under supportive care?
Protecting the horse from injuring itself is huge. If they're stumbling or disoriented, they need a deeply bedded, safe, padded stall, sometimes even a helmet if they're head pressing severely.
A helmet, wow.
Yeah, whatever it takes to prevent trauma. If photosensitization is happening, they absolutely have to be kept out of direct sunlight, manage any bleeding issues with vitamin K1, or maybe even plasma transfusions if it's severe.
And any supplements or liver protectants?
Yes. Often vets will use things thought to support liver health.
Hmm.
S-adenosilmethionine or SME and silymarin, which comes from milk thistle, are common ones. They're considered antioxidants and potentially liver protective. B vitamins are usually given too, and sometimes anti-inflammatories like flunixin maglumin, carefully, to manage inflammation.
And the third leg of the stool, so to speak, treating the original liver problem. That sounds like the key to long-term success.
Absolutely. You can manage the HE signs with diet and supportive care, but for any real chance of long-term recovery, you have to address the underlying cause of the liver failure.
And that treatment depends entirely on what the biopsy and other tests showed.
Precisely. It's totally dependent on the specific diagnosis. It might mean long-term antibiotics if it's a bacterial infection like cholangiohepatitis.
Hmm.
It might mean removing the horse from pasture if toxic plants are the cause, or changing the feed if mycotoxins are suspected.
Okay.
If it's thought to be immune-mediated hepatitis, corticosteroids might be used, but only after you're sure there's no infection. For those ponies with hyperlipemia, specific treatments like insulin, glucose, maybe heparin are needed to tackle the fat metabolism problem.
Wow. That was an incredibly thorough look at equine hepatic encephalopathy. Just uh, charting the course from how liver problems can cause such chaos in the brain through all those diverse signs and the really complex approach needed for diagnosis and treatment. It really hammers home how interconnected everything is in the body.
It really does. I think it highlights just how vital the liver is, maybe in ways we don't always appreciate, for overall health, and how quickly and dramatically things can unravel when it's compromised.
Yeah.
And, while the prognosis is often guarded, especially if there's significant scarring or the signs just keep getting worse despite treatment, being aggressive with supportive care and really pinpointing and treating that underlying cause gives the horse its best shot.
What really strikes me is how some of the earliest signs can be so subtle. A bit of dullness, maybe being a little too friendly. It shows how these seemingly small behavioral changes can actually signal a massive internal crisis.
Indeed, it really emphasizes the importance of knowing your horse and paying close attention to any changes, however small they might seem.
So maybe a final thought for your listener to mull over. Thinking about this liver-brain connection, what other conditions, perhaps in different species, involve seemingly unrelated symptoms that actually point back to a hidden underlying problem in a completely different organ system? Something maybe not immediately obvious. That wraps up our deep dive for today. We really hope you've gained a clearer picture of this complex condition and a deeper appreciation for the incredible, intricate balance within the equine body. Until next time, keep digging and keep learning.